Hello and welcome to the Also Ravishing Podcast. If you are new to my channel, welcome, welcome, welcome. I would love if you would check out my content, and if you like what you see, comment, share, like, subscribe, and don't forget to hit that notification bell. So when I drop a podcast or go live or any other content, you will be notified. And trust me, you won't be disappointed. And to all my returning subscribers, thank you, thank you, thank you. You know I love you, love you, love you. Now let's get into it. So, y'all, today is part 2 of medical insurance. If you haven't saw part 1, please go back and watch my podcast from last week. It was part 1 on medical insurance. On that podcast, I talked and explained HMO versus PPO, deductible, copays, out of pocket expenses, and 2 different insurances on one person. So today, I will be talking about insurance claims, allowed amount, balance billing, medical authorizations, and explanation of benefits. Claims. A health insurance claim is a request for payment to your health insurance company for covered healthcare services or items. Typically, you would not have to submit your own claim. The hospitals, healthcare providers take care of that process. But however, if you ever need to file an insurance claim for yourself, I'm going to give you some tips. Tip number 1, write clearly and legible. Number 2, file your paperwork promptly within the time that they give you. If needed, include your pre-authorization. Include all necessary information that they're asking for. Include procedure codes. You can get your procedure codes from your doctor's office or the hospital. And make sure you use the claim form from your insurance company that's for your benefits plan. Okay? Allowed amount. A medical allowed amount, also known as negotiable rate, eligible expense, or payment allowance, is the maximum allowance, the maximum amount your health insurance plan will pay for a covered medical service. It's a predetermination price your insurance company has agreed upon for the service based on their fee schedule contract and your plan benefits. Balance billing. Balance billing happens when the provider bills the consumer for the difference between the provider's charge and the amount allowed by the healthcare plan. So I know it's a lot of medical talk, so I'll give you an example. For example, if your healthcare provider charges you $100 and for a service, and your insurance company allowed amount is $70, that's the most they're going to pay for that doctor's visit, then you will be billed for the remaining $30. Medical authorizations. A medical authorization, also known as prior authorizations, pre-authorizations, or pre-certifications, are approvals from the insurance company for certain medical services or prescription drugs. They help ensure that care is appropriate, timely, and safe. Your doctor's office is responsible for getting pre-authorizations. Please make sure if you are having any kind of procedure, test, operation, and it requires an authorization, make sure that doctor's office get that authorization before you have any one of them services. Now, a lot of times patients do have them services. Authorization is not on file, and the doctor's office is able to obtain that authorization after or doing. But for any reason, if you have any one of them services done and your insurance company denies that authorization, and you have already had that test done, that procedure done, or that operation done, you will be responsible for the bill 100%. Your insurance company will not pay a penny. So always make sure that authorization is on file before you have a procedure if an auth is required. Explanation of benefits. Explanation of benefits, better known as EOBs. An EOB is a document sent by your health insurance company. It's not a bill. It gives details of the services that was rendered and the costs covered by your insurance company plan. For a medical encounter, EOBs inform you about the services provided, the costs. It shows you how much your insurance company paid, and it also tells you of any out of pocket that you might have. You might have to pay expenses that you are owed. Information that's included on the EOBs will be the date of service, the provider's name, the description of the services, the billed amount that the provider charged, the allowed amount that will be your insurance company agreed upon, the amount that your insurance company actually paid, and again, the amount that you will be owed, your responsibility. So I know a lot of you are asking, what's the difference between a claim and an EOB? A claim is a request for benefits payments that's filed with your insurance company. A EOB is a summary that is sent to you after the claim is received. You should always keep your EOBs. Your EOB is proof that this is the service that you had done. These are the codes that was charged. This is how much everything was. This is how much my insurance company paid. And this is how much you, the provider, stated that I owe or do not owe. Okay. So you can get a EOB in the mail and don't get a bill. Don't get a bill from the provider. That typically means that everything that was done, your insurance company paid 100%. So you won't get a bill, but you will still get an EOB because, that's your explanation of benefits. That's telling you what you had done. And it'll also show on there, zero responsibility if you don't owe any money after your insurance company have already paid their portion. So everyone, this is the end of part 2 of health insurance. I hope everyone enjoyed this podcast. I hope once you look at part 1 and part 2, you have a much better understanding of health insurance. I know it can be a lot. Next week, I will be wrapping it up with part 3, the final part of health insurance. I hope everyone tunes in. If you have any questions, please drop me a comment down below. I would love to answer it. And if you don't want to drop a comment, but you really want to ask me something, my email is on my channel. You can always email me and I'll email you back. So y'all, until next time, remember, love, live, and laugh. I'll see y'all later. Bye.